Welcome, everybody. I want to introduce Aileen Jackson. She is one of our orthopedic navigators, and she is over at our Brazelton campus. And give you a little bit of history on Aileen. Aileen she is an orthopedic certified nurse, but she's actually a bariatric certified nurse as well, and has been for many years. So she's one of my colleagues and very much understands our bariatric population. So I wanted to bring her in and interview her and ask her some questions that I think that you guys would be interested in regard to your joint health, joint pain, and what to do if that joint pain continues after surgery. So hi, Aileen. Thank you for taking the time to be with us today.
Hey, no, I'm excited. This is great. I'm sorry I can't be there in person when you have your meeting, but at least we can get some information to your patients. I am happy to help however I can.
Thank you so much. So one of the questions that I wanted to start out with is we often talk about the impact of obesity on the entire body. And so our patients have heard many, many times about how it can lead to other health conditions like diabetes and high cholesterol, hypertension. They're very used to hearing that. But I think one thing that's not often talked about is how obesity can lead to joint pain and then maybe even possible joint deterioration through the years. So I wanted to ask you, how does carrying extra weight actually impact our joints?
So, I mean, you are right. There are a lot of different issues that carrying extra weight can do, definitely on the knees and hips. One of our surgeons does a wonderful speech, kind of stole a little tidbit of info from him, and he expresses it very, very easy to understand. So for every 1 pound of weight that you have in your body, that 1 pound causes 3 pounds of pressure on the joint. So for instance, if you are carrying 10 extra pounds over your healthy body weight, then you would imagine that would be 30 pounds more pressure on your joint every time you take a step. So if you imagine, if you take 1,000 steps in a day, you are, I see you nodding, yeah, you're putting the 30,000 extra pounds of pressure on those joints. So it's definitely, the joints could definitely wear out faster. You might have more pain. I see a lot more issues with folks that that are of a higher BMI.
Mm-hmm. Yeah. And so that explains too, to me, why frequently our patients who come to us looking for weight loss are really struggling with a lot of neck pain, back pain, joint pain, even ankle and foot pain. So that makes a lot of sense. One of the things that we spend a lot of time educating our patients on, both before surgery and after, is that we have a group of medications that we ask our patients to stay away from. And those are things like steroids and NSAIDs, non-steroidal anti-inflammatory medications that, if taken after surgery in particular, can lead to gastric ulcers, which can be a big complication for our patients afterwards. So I wanted to talk a little bit about patients who are struggling with joint pain and maybe some safer alternative medications that they could use to treat their joint pain that's going to be safe for them even after surgery.
Absolutely. And, you know, the go-to medications, if somebody comes in to a orthopedic doctor's office and they are having problems, they're pretty much their simple first line of defense is doing those NSAIDs and steroids, which are definitely a no-no. We don't want to cause any problems after having bariatric surgery. So there are other options available. Things over the counter, I know a lot of people say this doesn't help, but Tylenol arthritis, there's something extra to it. It's just a little bit stronger of a dose of Tylenol. Of course, follow the instructions on the bottle. That's always an option. You've got topical items, or I should put creams, ointments that you can put on the affected joint. So over-the-counter ones, stuff like BioFreeze is wonderful. I hear a lot of people talk about Blue Emu. I haven't ever used it myself, but I do hear them talk about that. And then a prescription one, which is nice. And a lot of people have heard of the pill form of it, but it's called Voltaren gel, and it is an anti-inflammatory medication, but since it's in a gel form, you put it directly on the affected joint, and it doesn't go through your stomach, so it's not going to cause any issues to your bariatric surgery. So that's a safe route, easy first step to go. Something that you could even talk to your primary care about if you're saying, hey, I want to try and address this before I jump straight to go and see an orthopedist. Right. How can you get this taken care of? So that's always something that we can do. And then there are, if those things don't work, there are the options of injectable steroids and anti-inflammatories. Again, not going through the stomach, so you don't have to worry about that breakdown. Now, they don't do them, it's not going to be multiple in a row that you'll get. They'll only do that maybe 2 or 3 times. There's other injections to, say for a joint, for instance, that can increase the lubrication in the joint. So you're not having so much pain. A little bit different than an anti-inflammatory, but still options that are available, because no orthopedist is going to say, hey, let's jump straight to having that joint replaced as the first treatment plan. We're going to have other options to go through.
Right. Well, I like the way that you explain that, because, you know, when we say no steroids or NSAIDs, some patients may think that's across the board. And to be clear, we can use them, but it has to be in a way that it's not going to go systemic. It's not going to go all over their body, and it's going to be absorbed differently. And so I like what you said about the knee injection. And that's something my bariatric surgeons have talked about, is it has to be something that's going to go just to that joint and not really impact the rest of their surgery. So I love that. One thing in my experience with Voltaren gel in particular is it is something that needs to be prescribed. You have to have a doctor's order. But sometimes it also has to be pre-authorized by your insurance company. And they may have to justify it by saying, hey, this is a patient that can't use those other medications that typically we would try first.
Yeah.
And that also reminds me too, you know, just in saying, you know, if someone goes to an orthopedic surgeon, that's a very good example of why they need to know your history of having bariatric surgery. And the patients need to be their own advocates. And of course, they can always call us for questions, but they've got to be their own advocate and say, hey, I've had bariatric surgery. I'm not allowed to have this by mouth. So,
because, and bless them, I love orthopedic surgeons, but, you know, they just go with their go-tos. But if you, exactly, I was going to say that before you said it, you know, you be your own advocate and say, these are things I can't have, whether you had your bariatric surgery 3 months ago, 3 years, 10 years, it still remains the same.
Yeah, good point. Good point. Some of our patients forget that over time. So
truly,
it doesn't matter how long ago it was, it still stays true. One of the other things I want to talk a little bit about is that when, of course, our patients start getting engaged in the program, we ask them to start making some of those lifestyle changes that are going to be really important for them afterwards, like focusing on a high protein diet, cutting out snacking, getting enough fluids in. But we also ask them to start exploring ways where they can get more physically active. And, you know, if they've got back pain, joint pain going on, that can be really difficult for them. So are there any exercises or activities that you would recommend that are maybe easier on the joints?
So anything low impact is going to be better for the joint. So, and actually better for your bones is you don't want to do anything high impact, running, things like that. That's going to be painful. But even just walking, you can do water aerobics or Zumba, for instance. And I think they even have like water Zumba some places, which I feel like would be extremely fun. But anything just to get your body moving. Now, in preparation, when we do have folks that come through and do surgery, we do some preparation with them as far as educating, hey, some activities, some stretches, some exercises, all very basic things to do. So, you know, moving your ankles up and down. It's all about blood flow and getting your muscles moving. And it might not even be a bad idea in that whole process leading up to or treating this joint pain that you're having, physical therapy could definitely be an option for patients to pursue as well. And they can give you some instructions on what are safe exercises to do if you're having this pain, what's going to make it feel better, and ways to work around it to where you can still be active but not hurting at the same time. There's
Okay.
it's hard balance, but those lower impact activities are going to be best.
Great. And I know here in Gainesville, we've got a couple of places where patients can get engaged with water aerobics and things like that. We've got Francis Meadows here off Jesse Jewell. We've got the YMCA that's very close by too. So those are great suggestions. I love that. So I know that, many of our patients that are about to have surgery are very hopeful that by losing a lot of this weight, it's going to take the pressure off of those joints. And I think you had mentioned to me before that even just losing 10 pounds can even alleviate a great deal of pressure, from their joints and hopefully improve that. But if after they've lost a significant amount of weight, they find that they're still maybe having some joint pain, possibly some joint damage, what's the next step for them? What would you say they need to do next?
I would definitely, you can always start with your primary care. If you've lost the weight, you're not seeing the results in the decrease in joint pain as you expected. Maybe it's a little bit better, but you're still dealing with some issues, some difficulties, some pain, especially I hear a lot from folks on rainy days, things like that. A perfectly good option is, starting with your primary care. Can I get some of that Voltaren gel to see if it works? Or if you've gone down those avenues, definitely reach out to an orthopedist, get an evaluation, or maybe get two to see which is best fit for you. But then, like I said before, maybe an injection, one of those lubricating medicines, maybe some physical therapy to strengthen up the muscles around the joint to really help support it can be better. And, I know I deal with folks after they have their joints replaced and they'll say, oh, well, my other leg hurts now. Well, because you're relearning how to walk again now that you have this good joint that's not causing you problems. So same thing, when you lose weight and you have this joints feeling better, you're doing a lot more. You might find that you have other aches and pains because you're just, activating other body groups and muscle groups, and doing a lot more than you did previously. So you're kind of challenging yourself. But if you find that you're still hurting, I say definitely seek out some help, because there are some things. It's not jump straight to surgery. There are some options that you can go through to see if that can help you and allow you to continue to be active.
Okay, great. Awesome. One of the other questions that I thought might be interesting is if a patient needs to have a joint replacement, and this is just across the board, but they are carrying some extra weight, how would that impact a patient that would be undergoing joint replacement surgery? Does it matter what your weight is when you undergo surgery? Does it change the outcomes? What does that look like?
So there's definite recommendations from the Academy of Orthopedic Surgeons saying, somebody who has a higher BMI, that 45-50 range, it would definitely be recommended to lose weight, whether it be through a surgical bariatric program, if it's a medical weight loss program, just to lose weight to help make that surgery safer. When you have that higher BMI, you do have a lot higher risks when it comes to surgery and just anesthesia purposes. We do find that a lot of our readmissions after surgery, if they're having an issue, most folks do have that higher BMI because they just have a lot of other comorbidities going on. And if you go back to the information that we talked about first about getting that weight off, you're taking some of that impact off of the joint as well, taking some of that pressure off of the joint. So somebody with a lower BMI, their joint is going to, once they have it replaced, it's going to last longer than somebody with a higher BMI too.
Good point. Good point. I've actually had conversations through the years with some orthopedic surgeons who, and this was years ago, who didn't understand, that yes, it's going to make it easier for your patient as far as lower infection rates and less time in the hospital. But it's funny because I caught their attention when I said, and the work that you do, it means that the joint that you're going to give them is going to last a lot longer. And all of a sudden they're like, oh, yes, yes, you're right. Okay. So I think you've already answered this next question. It was about if they do need a joint replacement, how can they prepare for surgery? And I know that you'd mentioned there are some exercises that they can do that you guys teach them.
Yeah, sorry, I don't mean to interrupt you, but along those same lines, just like with our bariatric program with the hospital, we do, or I do, an educational class with folks to prepare you for surgery, because it's not just the run-of-the-mill type of thing. Everybody's a little different. We want you to be successful, get all the benefits of having the new joint. I had one therapist tell me a couple of years ago, say, when you have a joint replaced, it's like sending you home with a new baby. So the doctor hands you the baby, and then you've got to grow it, or your joint, they're handing you this new joint, and you've got to heal it and get it strong and get it working again. So we do a lot of, we have a online educational platform that we send out to folks that we can follow along with them, that gives them videos of exercises. We do a Zoom class, and then also when we didn't have coronavirus, we did in-person classes on preparing and going over the exercises and getting people optimized before they come in for surgery. So it's not just you walk in the door, you get a joint, we send you home. We are definitely gonna, if you come to Brazelton, you'll be stuck with me for a good at least 30 days after you leave the hospital, to call in to check in and make sure you're doing okay.
And that actually leads us to our next question, which is, if someone were to need a total knee or a total joint or total hip replacement, what is the average length of stay? How long do they normally stay in the hospital these days?
So current state is generally just one night. So most folks come in, have surgery, spend the night, are gone before lunch the next day. We do have some folks that don't have comorbidities or different problems. They very well might go home the same day. That is something some of our doctors are trialing and seems to be going very well with folks. But I would say 99% of the time it's a one night stay, and then we get you out of here. But we got to make sure that you're safe walking around, you have your equipment that you need, physical therapy is giving you the go ahead, your pain's controlled, that type of thing, before we let you go. But generally the next day by lunch, you are at home, probably sitting in your recliner and resting. Right.
And is there anything that they would need to do to prepare their home if they were considering having a joint replacement?
You know, absolutely. And this is something, if you have a bad knee or bad hip anyways, and are prone to tripping, picking up trip hazards out of your way, rugs that maybe you catch the corner, your toe on the corner and you maybe stumble, or slippery surfaces, having a mat outside your shower so your feet can dry off before you step on a hard surface floor so you don't go skating across the floor. I said rugs, cords, tuck them against the wall, out of the way. Watch out for small animals and children. I always mention that too, because they tend to get under your feet. I don't know how many people have come in because they've fallen down because the dog got under their feet and they tripped down the stairs. Make sure you have a good handle to hang on to when you're going up and down the stairs. What are some other small things? Safety rails in your bathroom, believe it or not. If you're not 100% on your feet, you can get some really strong suction cup handles for your shower so you can hang on to, so you aren't if you're feeling a little wobbly, you've got something to hang on to and you're not going to fall down. Oh,
that's a good one. Okay, that's new. I've never heard of that. Okay.
Home Depot, Lowe's, I feel like I should have some stock in there. I send people there.
I know a big question for a lot of people, when, even if they're in pain, you know, they may be dreading going to consider surgery, and they're thinking, okay, how much time am I going to be out of work? Sure. You know, am I going to need help around the house? So what does that look like after somebody's had joint replacement? How long would they need to take off of work? How long until they can get back to normal activities?
Sure. So our recommendation is we always like to make sure that every patient has somebody at home with them for the first, I say, handful of days. So 3, 4, 5 days, because you're not 100% on your feet. You need somebody there because, gosh, you're moving around with a walker. You're moving a little bit slower. Say you go to the kitchen, you get back to the living room, you sit down, you get settled, you put your feet up, and you're like, gosh, my water is in the kitchen. And that's a whole process to get back over there. So little things like that. But we want to have somebody at home with you to make sure you're safe. Those first 4 or 5 days until you're really feeling confident moving around with this new joint. Additionally, as far as therapy goes, healing this joint and getting the full range of motion back into it, I have to give folks it seems like a really wide range of recommendations. So the recommendation is 6 to 8 weeks of therapy between 2 to 3 times a week. Now, I feel like that should have an asterisk after it because everybody is different. So if they are really knocking it out of the park and meeting all their goals, the therapist might say, gosh, we really don't need to see you 3 times this week. You're doing so good. Let's bump it back to 2 and then go from there. Here's another one. I normally get, when can I drive again? Well, if it's your right leg, your driving leg, it's going to be a little bit longer than it would be your left leg, but we want to make sure that you have that reaction time, because not saying that the patients are the bad drivers. There's a lot of crazy drivers out there that'll pull out in front of you, and you've got to have that reaction time with the leg to fully push down on the brake if somebody were to catch it off, or heavens, who knows what else they might do. But so usually it's a few weeks before you can drive. Most people, as far as work goes, depending on what you're doing, if you have a desk job, probably 3-ish weeks, 3 to 4 weeks, depending on how you're doing. If it is a more active job, it definitely can be longer than that. I get school bus drivers that come, and that's a lot of up and down those stairs and moving around. So normally we'll tell them probably about 6 weeks before they go back to work, just to make sure that they're safe and they're 100%. We don't want anything to happen to you. The last thing we want somebody to do is fall in their new joint.
Right.
Mm-hmm.
Well, that's all the questions I have. Anything else that you would add for this group?
I don't know. I can't really think of anything else off the top of my head. I'm happy to answer any questions. If you collect some from your meeting, I can definitely get you some answers. But congratulations to everybody who's gone through surgery. Good luck if you're in the process of going through it. Stick with it. I know it's hard.
Miss Aileen knows firsthand what it takes that our patients go through, for sure. So, all right. Well, thank you so much for taking the time. I think we got some good information about how to treat joint pain, even if it's just, before you've even had any sort of surgery, whether you're seeking bariatric surgery or not. But kind of the resounding message that I heard is that if somebody does need to have a joint replaced, they're going to be healthier and they're going to have better outcomes if they can get their weight lower into a good, healthy level all the way around. So there's a lot of orthopedic surgeons that are sending people through bariatric surgery first, so that they can be healthier and get that done. Awesome. Well, thank you so much, Aileen, for taking the time, and I will submit some questions to you if I get some tonight.
Awesome.
Thanks so much.
You're welcome.
Bye-bye.
Bye-bye.